Hello everyone out there, my name is Harshita Lohani and I'm a research scholar by profession at IIT Bombay. In this video, I'm going to talk about how to provide trauma-informed care to your loved ones. If someone you love is suffering from depression, then you must also be experiencing a lots of negative thoughts like fear, sadness, helplessness and anger. It is not easy to deal with a loved one's traumatic phase, and in this case if you neglect your own health, then it can be overwhelming. But your companionship and support can be crucial to your loved one's recovery. You can help them to cope with traumatic symptoms, overcome negative thoughts and regain energy, enjoyment and optimism in their life. So first I will introduce you to trauma. What is trauma? Any event that overwhelms a person's capacity to cope and has long-lasting impact. In other words, we can say an experience that overwhelms a person's resources for coping, and this experience disrupts a person's sense of safety, perception of control and the ability to self-regulate. Now coming to what is trauma-informed care, a strength-based framework that is grounded in an understanding of and responsiveness to the impact of trauma, which emphasizes physical, emotional and psychological safety for both providers and survivors. So just now you have seen that trauma-informed care not only ensures the safety of survivors, but it also ensures the safety of providers. And there is a difference between providing trauma-specific care and trauma-informed care. Trauma-specific care is performing specific therapies or treating specific symptoms related to trauma, and these can only be performed by the experts in the field of trauma. But trauma-informed care can be performed by anyone for their loved ones. So there are 4 key assumptions of trauma-informed care. Number 1 is realization that trauma is common and can be treated. Number 2 is recognize signs and symptoms of trauma and its effect on physical, emotional and social well-being. Number 3 is respond with dignity and respect to the trauma sufferer. Number 4 is resist re-traumatization. Being bossy, aggressive and confidential can trigger the signs of trauma in the patients. Now the question is how to start conversation with such people. So before going ahead, remember one thing: being a compassionate listener is much more important than being an advisor. And don't forget to show your concern and willingness to listen over and over again. I'm going to show you 2 video clips where you will get to know the power of words in dealing with a trauma sufferer.
Hey, what's wrong with you? Nothing, I'm just fine. Hey, I wanted to check in with you because you have seemed pretty down lately. Yeah, I'm not feeling so good from past few days.
Just like there are ways to ask, there are ways to respond. So here are some of the ways in which you can respond to a trauma sufferer. What happened to you was not your fault. I am sorry you were hurt in that way. Would you like me to reconnect you with someone who can talk to you about this? So, remember, you don't have to be bossy, aggressive, or you should not be in attitude while talking to a person who is suffering from trauma. So in summary, the key ways to provide trauma-informed care are Be courteous, friendly and patient. Ask to assist. Ask about prior trauma. Do a lot of listening. Don't force conversation. Resist interrupting. Respond to trauma disclosure. Communicate care and concern. Avoid passing judgments. Convey your availability. Check in regularly and move at the patient's pace. If you will follow these key ways, you will definitely be able to help the person who is suffering from trauma, and you can help them to get out of their traumatic phase. Thank you for listening.